From taking their first few steps to developing their very unique and strong personalities.
YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, a show where we encourage you viewers to send in your questions and so that I can answer them in real time. I'm Dr. Scarlet Constant, founder of Constant Care Pediatrics, the sippy cup spout and how to drink from a cup. And at this point, from 9 to 12 months, you'll usually start to wean them off of the bottle. So by 1 year of age, they should no longer drink from a bottle. An easy way to do this is also to give your child water in the sippy cup, or if they're drinking juice, you can give juice. And then eventually you want to transfer the milk to the sippy cup so that they don't associate. Your toddler is going to have their DTaP booster as well as their hip booster. And then at 18 months, they'll finish any of the series that they haven't completed at 15 months and complete the hepatitis A series. And by that point, thankfully, your toddler has a little break and doesn't get vaccines again until they're 4 years of age. This is very important because in the infant period, your child was getting vaccines from Facebook, sides of the fence when it comes to potty training our 27-month-old son, Kenny. Joe says Kenny's ready now, but I disagree. When do you think parents should begin potty training? And what are the signs that they're ready? Well, Dina, this is a great question. And I think a lot of families battle with this because potty training is not only difficult, but it's child dependent. So to answer the second part of your question first, it's important to understand that your child has to be able to communicate with you. Not only communicate with you and let you know that they would like to use the bathroom, but also for them to understand the importance of going to the potty. So if they can understand that they need to go to a potty and pull down their pull-ups, and they can also tell you to bring them, or they can tell you that they really need help and they would like to go, then you know that they're ready. Look at this reel, you can just send them in, you can watch this video.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc.
While moisturizers are very helpful, that's not going to cure an acute exacerbation. For example, if there's an eczema patch or a patch of itchiness or redness. So usually your pediatrician or dermatologist, if you have one, would suggest topical steroids, which help to decrease the.
This little guy has done this nightly ritual since before he could walk. Like 20% of kids, Max has an overactive immune system.
Eczema, better known as atopic dermatitis, is a sensitivity of the skin.
Network, I'm Vivian Williams.
Well, I hope that video was helpful. So now we have a question coming in from the All Health TV as a battleground. And what that means is that we can offer our children maybe 1 or 2 options to eat, but we have to make sure that it's not something that seems forceful or that is contentious or something where you are really upset because they're picky eating. Is that this is a time in your child's life where they finally are learning a bit about autonomy. So they understand that if they say no to something, you will actually listen to them and maybe not even offer little florets of broccoli, so that they're introduced to something new, but they're also eating something that is comfortable to them. Number 2 is that we want to create a positive eating environment. Like I mentioned before, we don't want to come in where we already know that mom and dad are going to be frustrated if I don't eat, or they're going to be very upset if I don't eat my vegetables. It's important to have a pleasant environment where food is not a battleground and we can all sit together and make mealtime fun. You and your spouse can speak to each other while your child's at the table, or you can even involve your child in the conversation. But we should all eat together, and you can even share your food with your child just so that they can experience the food that you're eating. And I really do think, with that said, it's really important if you can just make the same meal and everybody eats the same food rather than making a child specific meal. I think the best thing to do is try to create a meal for the entire family. Number 3, establish a routine. So it's very hard today, I know, with everybody's work schedules, and it seems that people are in and out of the house and traveling, but if you can create a routine and have a designated time to eat, at least for dinner, That makes a world of difference. It's something where your child knows that this is coming, they understand that this is a ritual and we all do it together, and then it becomes a community feel. So they're eating with community, and believe it or not, children really benefit from that. So if you have a regular meal time, that will really help, and you want to limit the snacks throughout the day. You really don't want to have a child that's munching all day long, because as they are small, they're young, they have smaller appetites than we do. They tend to feel satisfied with snacks before meal. So oftentimes they're not eating because they really just don't feel hungry. So I would try to limit snacks during the day and limit grazing. You don't want your child to have little bits of meals throughout the day. So by the time you sit down for what you feel is your routine meal, they're already a little full. So try to set a routine and try to limit your snacks. Number 4, encourage self-feeding. So a lot of times, and this is what I meant about transitioning between a parent of an infant versus a parent of a toddler. Parents of infants, we're used to still feeding our babies and taking the spoon and putting it in their mouth, and they get used to it too. But it's really good to make sure you pull away from that and let them feed themselves, whether it's with a fork, a spoon, or even their hand. It tends to be a bit messy, but this is part of the autonomy that they want. They want to feed themselves, they want to explore, they want to eat on their own, and they want to feel like they're part of the community, like I mentioned before. So if you're all sitting at the table together and you're feeding yourselves, let your child feed themselves. Number 5 is be patient and persistent. Please be patient. There's nothing worse than getting upset at dinner. It just creates a very negative tone around eating, and it's just going to set the tone for the days to follow. So be patient with your child and make sure you're persistent. If they don't eat today, you make the same meal and introduce it again the next day. And you try to introduce that same thing at least 2, 3, 4 times until you find out that really they just absolutely refuse it and put their foot down. Sometimes you've just got to take the loss and move on. But if you're persistent and really try to encourage them to try this new meal or item or food group, then they'll give in and they'll taste it, and then they'll learn that they actually love it. So number 6, the final point, is model healthy eating. You know, this is really important because a lot of times we want our kids to eat, and you're standing and you're trying to get things done and you just put food for the kid and you think that they're just going to eat it and love it and have this great experience. But if you're not sitting with them and eating as well, this is not something that they see, then they're going to learn from you. You want to eat and show your enthusiasm for food. Show that you eat vegetables and these lovely food groups and all these wonderful colors blended together. If they see you do it, they're learning from your example. And if you're eating healthy, then they'll eat healthy. If you're having something unhealthy at your plate that looks delicious, or maybe a huge plate of French fries, it's only natural that your kid's going to want the same thing. So try to have them model your behavior. The baby in your wife's belly, as he watches your wife's belly grow, he'll understand that there's a human being growing there. There are many wonderful books on little brothers and little sisters and mommies expecting, and you can read those to Lance at bedtime and integrate it to your life and explain to him that this is what's going to happen in your home. I think it's also very helpful to get a doll, because a little baby doll that Lance can hold and understand that that's what his little brother or sister is going to look and feel like, and he's going to take care of them, and they learn how to nurture and to look and feel like, and he's going to take care of them, and they learn how to nurture and take care of a baby by having this.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
So I hope this answers your questions about picky eating and new baby arrivals. It looks like we have sleeping and that they're going to be safe. You want to reassure them that you're in the home and that they're safe. You want to maybe set up a night light for them so that they don't feel too scared. Have your routine before bed. Read your book before bed and explain to them that you're there, but you will leave so that they can sleep. And this is a nice way to get them used to the same routine and feel safe before they go to bed. Once they're asleep and they do continue to wake up, you want to make sure that no matter what, you are not feeding them or giving them water or giving them anything because that will just kind of reestablish this routine of waking up and wanting something. So you really don't want to give them those things. You want to just reassure them and put them back to bed. So a couple of tips for successful sleep routine is, as I mentioned, you want to establish a regular bedtime. That's the most important. Secondly, you want to create a comfortable sleep environment. And that just means maybe a little night light so that it's not completely blacked out in their room. And when they do wake up, they're not afraid, and they'll be able to stay in bed and self-soothe. You want to encourage self-soothing because you don't want a child to be dependent on you to get them to get back to sleep. They need to know how to get back into bed, relax, feel safe, and fall back asleep. So encouraging self-soothing means not rewarding them with a bottle or a sippy cup or having them come into your bed and snuggle you until they fall asleep and then you carry them back. You really want to leave them in their own environment and allow them to fall asleep on their own. That doesn't mean that you don't go in there and spend a little bit of time with them and reassure them. It just means that you don't want to stay too long and you don't want to overstay the soothe. You don't want to basically lull them to sleep. You want them to soothe themselves. Number 5 is you want to promote physical activity during the day. Of course, that's important. You don't want a toddler that already has a sedentary lifestyle. You want to play and have them exercise and be physically active. Now, I want to clear something up. Some parents feel that they want to jam-pack their day so that their child is drained at night and goes to sleep, and it doesn't really work that way. As a matter of fact, contrary to that, if a child is overstimulated and overly tired, it's much more difficult for them to get to bed. So please don't try to, quote unquote, wear them out during the day. You also want to use a gradual approach to sleeping alone. And what this means is that you let them know that they are sleeping in their own room, but you can stay with them for a while and let them know that you're there, but also be open about the fact that you are going to leave the room and you are going to sleep in your own bed and you are going to leave them alone. You never want your child to fall asleep thinking that you're right by their side and you're with them the whole night, because when they do wake up in the middle of the night and you're not there, they feel lost, almost abandoned and tricked. You're essentially tricking them, and we don't want to do that. You do want to be open with them and let them know that they will be sleeping on their own and you're going to go to your room, but they know how to get there. They know where you are, and if they need anything, they can always come get you. And last, but you want to stick to the nighttime routine. And that's what I had mentioned before, is you don't want to basically deviate from what your normal night routine is, and you don't want to push the bedtime. What happens with toddlers is that there are a lot of emotions that they have that they don't quite know how to express. And so oftentimes those emotions are blown up and they express them by screaming and throwing themselves on the floor and demonstrating what we call a temper tantrum. So a good way to prevent this from happening, especially in public or at an untimely moment, you really want to think back about the things that you know will actually trigger the tantrum. And oftentimes the triggers are either transition from one environment to another or transition from one task. Put them in the car and drive on to the next location and they don't know what's happening. There goes the temper tantrum. They can't express to you that they're frustrated, or maybe they were having a skill. They can't express to you that they're frustrated, or maybe they were having a skills come on their own. A lot of parents are very concerned about socializing their child and putting them in school and trying to get them around other kids. This is a natural skill that we all develop. So your child will develop those skills after 2.5, usually by age 3. And that will come when they play with their friends, go to a park, or go to any type of learning center. As long as they're around other kids, it will come on their own. You don't have to worry about teaching it. And sharing just comes from you modeling your behavior. So